Hi everyone. I hope everyone can hear me. It's 2 p.m. here where I am in Geneva. So good afternoon, everyone. Just a quick note that we'll be kicking off in probably the next minute. My name is Homa, and it's good to see so many familiar faces. We're just waiting for a few more participants who are just being added to the call, and then we'll kind of proceed in the next 60 seconds. Hi everyone, welcome to the second Nurses Network meeting here at PSI. My name's Huma and I am part of the health team covering nursing and care workers. And I'm going to be chairing today's event, which is focusing on violence and harassment and how nurses are on the front line of pushing back and how nursing unions are kind of making sure that their members are protected. Just some quick housekeeping. I'm sure many of you know we've been on many a Zooms now, but we have interpretation available in Spanish, French, Portuguese, and English. Please click on the globe, the interpretation globe at the bottom of the screen to find your preferred language. I will be speaking in English. We have a few speakers who will be speaking in English and Portuguese. The first half of the event and the agenda is going to be focused on hearing from some of our nursing affiliate unions and the specific work that they're doing. We'll also be hearing from our General Secretary, Daniel Batossa, who'll be talking a bit about PSI and opening the meeting. And then we'll have kind of time for an open discussion so we can hear from participants on this call and hear what's going on around the world on this topic. So hopefully we have everyone in the waiting room has been added in. So I'm going to hand over to Danny to officially open the meeting. Hopefully he is in the call. No, okay, he's not. I'm sure he's joining. I literally saw him 2 minutes ago, so I'm sure he's joining any minute now. But yes, before he does, as was mentioned in the invitation, the focus of today's meeting is about violence and harassment. Specifically, why we decided to focus on this is all the engagement we've done with our nursing unions, whether that was through the survey we did last year, whether that's the engagement we've done at a regional level, at global level through the Health and Social Services meeting. One thing that was really clear is that our nursing unions were telling us that violence and harassment is kind of the biggest occupational health and safety issue facing their members. So we thought this was a really good opportunity to kind of bring our unions together, strategize about how our members and nurses can kind of fight back against this. Here's some really good examples about how nurses have won specific contract language around violence and harassment, see what the situation is in different parts of the world, and how nurses are coming together, how they're campaigning and organizing to kind of win protections on behalf of their members. Danny, I can see him, so I'm going to hand over to our General Secretary, Daniel Potosa, who's going to officially open the meeting for us.
Thanks very much, Hilma, and it's great to see so many people on the call, and I think even more people registered. So I think they'll probably either join in a bit later on or watch the recording. We've been increasing our sector work, and in particular our focus on nursing, and also our focus on occupational health and safety. And we've recently launched our nurses network to involve as many unions as possible. And I'm really excited to see that it's growing and that we're getting more and more nurses unions involved, talking about the issues that matter to them. And I'm particularly pleased to hear that the Canadian Federation of Nurses Unions is here today, who aren't yet an affiliate, but we're working increasingly closely with as part of that broadening our base and building our power. as part of all of that, and I think Huma mentioned it, we've identified violence and harassment as one of the biggest issues facing our nurses, but also more broadly our health affiliates. It's come up in our occupational safety and health risks in care work, and it also really clearly came up, as Huma said, in our nurses survey. And because those who work in healthcare, the majority of which are women, gender-based violence in the workplace is a serious threat to women's safety and to their lives. And our Women's Committee is working on that as well as Huma and the health team. Now, we know that nursing staff encounter a range of potential hazards and often on a daily basis, but few are as distressing and perhaps as difficult to manage as aggression and violence, because too often it's dismissed as just sort of an occupational hazard, something that nurses just sort of have to put up with. But all nurses, like all health workers and all workers, have a right to be safe at work, regardless of where they're based, whether they're at a hospital or whether they're in a mental health setting, in the community or on other healthcare premises. And it's an issue that's made harder often because of the austerity measures that have been taken mean that there's underfunding and there's inadequate staffing in the health service, and therefore service levels are often undermined. So things like long waits for treatment and rushed care increase the risks of third-party violence, violence from patients, but also from family members and other members of the community. And it's not just physical. I think we all know that. It can also be psychologically really debilitating, leading to stress or to burnout, anxiety and depression. And all of this leads to diminished job satisfaction and can lead to lower commitment to work and increasing levels of absence amongst nurses. And there's a fair bit of evidence that shows that link. And it's unfortunate because that then often creates this loss of staff and a vicious cycle, because that loss or absence of nurses, because they're either off sick or perhaps because they leave the profession, it just creates a vicious cycle around understaffing. Now, we've got to hold all employers accountable for these risks, as well as the governments that fund these services, but particularly the employers, even when the underfunding and understaffing are partial causes. And to do that, unions play a critical role, especially in addressing the gender and intersectional-based violence and harassment in the workplace. I don't need to tell you that by coming together and negotiating collectively, it's really only unions that can create the power needed to ensure that everyone's safe and has an inclusive work environment, and that we can ensure that all workers, regardless of their gender or their other intersectional characteristics, are protected from harm at all times. Because we know that the violence and the harassment and also the stress doesn't affect all workers equally. Women, gender diverse workers, migrant workers, and other groups in vulnerable categories experience the situation differently, and unfortunately all too often have disproportionate exposure. One of the things I'm most proud of at PSI recently is our work with our affiliates at the International Labour Organization on ILO Convention 190 on violence and harassment in the world of work. And that came into force in June 2021. And that convention, 190, provides a foundation for trade unions and other stakeholders to address all of these issues. And PSI and PSI's affiliates were at the forefront of those negotiations, making sure that the voices of healthcare providers and particularly nurses were reflected in that convention. And now our work continues on that to make sure that that convention's ratified by as many countries as possible, but then also enforced, because we all know that without enforcement, these rights really don't mean a lot. And to do that, our Women's Committee has launched a gender and intersectional transformative risk assessment tool for our affiliates and their members to use in workplaces that helps workers and activists and your reps to identify the risks of violence and harassment, and also that psychological stress I was talking about, specifically tailored to public services like healthcare, but also recognizing that these risks, whilst they affect everybody, can affect different people in different ways. And what I like about it, one of the things I like most, is that it focuses on recommending practical measures to prevent and also to reduce these risks. And it also promotes, as I mentioned, inclusion and equitable workplaces through social dialogue and ultimately through collective bargaining. But I think the crux of it all is that in order to do this, in order to win these and other things as well for nurses and healthcare workers, it all relies on the power of organised nurses and nurses' unions building that power. And all unions at all levels, as well as PSI, has to play its part in that. And that's why PSI has redoubled our work supporting affiliates to organise and build power. We're currently working with nurses in Zimbabwe, Togo, Pakistan, and India, and also in the health sector more broadly in places like Kenya and Tanzania, but also in other places all over the world. So really that's what today's about. Thanks, Huma, and thanks everybody else for joining us. We're here today to hear from our affiliates, the people on the front lines, to share and learn about how they've secured safer workplaces through their unions so that we can tackle this scourge that unfortunately is far too widely experienced. So thanks, Huma. Thanks everybody for joining us, and I wish you all the best.
Thanks, Danny. Yeah, and we've got an excellent panel for you today at this meeting. We've got kind of hearing from nursing unions from right across the world who are going to be talking about how they're winning language within their contracts and in their collective bargaining around violence and harassment, how they're kind of pushing and advocating for new laws, how they're mounting campaigns and getting their members involved. So hopefully we get kind of a breadth of the work that unions are doing specifically on this topic. Our first speaker is from National Nurses United in the US. And I'm very pleased to welcome Jamie Brown, who is the president of National Nurses United, but also president of the Michigan Nurses Association, who's going to be talking about the specific work that NNU has been doing and kind of how you've been leading the way and kind of winning this in collective bargaining. So, Jamie, thank you for joining us, and I'll hand over to you now.
Good morning. As mentioned, my name is Jamie Brown. I'm a registered nurse and president of National Nurses United, the largest labor union for registered nurses in the United States. Thank you for inviting NNU to participate on such an important issue. U.S. nurses have seen rates of workplace violence rise over the past several decades and accelerate with the COVID pandemic. Nurses routinely experience violence on the job, including being kicked, punched, slapped, spat on, and threatened. This is in no small part because healthcare employers are implementing changes to staffing, workflows, and patient care that prioritize cost over safety. Employers seized on the pandemic as an excuse to accelerate those changes, which has only exacerbated the workplace violence epidemic in the US. But the good news is that union nurses have a lot of experience fighting employers' schemes and winning. Every day, NNU members are tackling workplace violence issues in our facilities, from winning strong contract language in collective bargaining agreements to fight back campaigns. Nurses have won measures like improved staffing, behavioral emergency response teams, removing last names from badges, improved de-escalation training, maintenance of broken alarm systems, and patient violence risk assessment and chart flagging system, which improves safety for patients and staff alike. I want to talk in a bit more detail about some of NNU's concrete wins. As a quick note, in the US, we have a patchwork of national and state level occupational health and safety protections. NNU and our state affiliates work at each of these levels to secure the most comprehensive protections for our members. First, NNU's state affiliate, the California Nurses Association National Nurses Organizing Committee, won statewide workplace violence protections in California. In 2010, a CNA member, Cynthia Pomada, died from a preventable workplace violence incident while working in a jail facility. Her death galvanized the union fight for enforceable mandates on employers to prevent workplace violence. Nurses' efforts resulted in a landmark standard that requires healthcare employers in California to implement unit workplace violence prevention plans. California employers must include input from direct care nurses and other staff and their unions because we are the ones with essential insights into what will be effective. Employers must track and report violent incidents, providing transparency and encouraging reporting of this issue that too many employers have treated as part of the job. And they must implement prevention measures like improving physical safety of workspaces, providing safe staffing, and ensuring that there are sufficient trained staff available to respond to incidents. California Nurses Association campaign to win with this standard was successful because it engaged members. Nurses turned out to hearings, took actions at their facilities, and spoke to the media. Nurses told their workplace violence stories, something that can be very hard to do, to relive the incident and the trauma. But nurses recognized that policymakers needed to understand what nurses face on a daily basis and that nurses' expertise is the key to shaping effective protections. Once the standard went into effect in 2018, nurses didn't stop. We knew that employers wouldn't follow the standard voluntarily, so we launched a robust enforcement program. The union made sure nurses knew their rights. We coordinated demands that the employers across the state comply with the new standard. Nurses escalated with collective action when the employers delayed. The legal mandate combined with the nurses' demands for protections have reduced workplace violence and led to improved safety in healthcare facilities across California. After winning California, nurses turned to the national stage. Because of our patchwork system, we know we must win a national workplace violence prevention standard to protect nurses across the country. First, we petitioned the Federal Occupational Health and Safety Administration for a standard. That petition was granted in 2017, but when the first Trump administration stalled, nurses turned to Congress. We have passed a bill through our House of Representatives twice and have built strong bipartisan support. Our members have been engaged in this entire process. We have held multiple lobby days where nurses have shared their experiences with legislators. They can be a powerful experience for nurses to see the impact of their stories on policymakers and can help bolster campaigns to remedy issues in their facilities. Even as we fight for a national standard, we've continued our work in the states across the country, and we've had several major legislative wins. In 2023, NNU's state affiliate, the Minnesota Nurses Association, won improvements to the state statute on workplace violence prevention. State law now requires healthcare workers to be actively involved in assessing workplace hazards, and hospital violence prevention plans require a process for investigating worker concerns and prohibits retaliation against workers who report incidents or concerns or who call local law enforcement. Hospitals must have a procedure for workers to request more staff when there are concerns about violence, and hospitals must maintain data and make it available to the state if the hospital denies a request. In 2025, NNU's affiliate, the New York State Nurses Association, worked to pass a bill to require hospitals and nursing homes to develop and implement comprehensive workplace violence prevention programs and improve security in the emergency room. NNU's state affiliate, the Michigan Nurses Association, which is also my home state association, continues to fight for workplace prevention legislation. We are engaged in educating our members on workplace violence prevention, including teaching nurses how to identify different types of violence, perform threat assessments, and techniques that can mitigate risk and prevent workplace violence. Underreporting is a big issue, so this kind of education is important organizing. As union nurses, we know that the state and even national laws are important, but they aren't the only avenue. Our union contracts and organizing in our facilities can win powerful protections. For example, nurses at Research Medical Center in Kansas, where winning is a state workplace violence prevention standard, wouldn't be possible given the patchwork protections. Identified workplace violence issues in their facility. So nurses organized, put pressure on management, and one patient assessment checklist built into the charting system, and white magnets that mark rooms of patients prone to violence to warn staff to take precautions. And when the hospitals built a remote employee parking lot, which was poorly lit, there was a cluster of car break-ins. A nurse committee called for the employer to address the issue, but the employer did not. So nurses leafleted at shift change and brought whistles and donuts for the nurses so that they would have energy to call for help or run, run, run. The union contract now requires keeping employee parking lots well lit. There are blue poles with emergency buttons and more security. The New York State Nurses Association won significant workplace violence protections through organizing and collective bargaining, including holding the largest nurses' strike in New York City history. New contract wins include improved weapons screening and panic alarms with GPS. Union nurses win improved safety when we organize and take collective action. We know that these actions protect not just us, but our patients too. And that's why nurses won't stop until all patients and nurses are safe. Thank you again for having NNU join in, and I apologize now that I must log off as we are in Washington, D.C. for our federal lobby days.
Thank you so much, Jamie. Thank you for taking the time to share that with us. I think it's incredibly powerful to hear about how nurses are kind of using their collective power to kind of win very specific, enforceable kind of protections. And those examples are really interesting and really great to hear. And so thanks so much for joining us. And I really hope the rest of your week in Washington goes well. I know it's an incredibly busy time for unions and, civil unions in the US. So thank you so much. And yeah, so thank you to Jamie. So now we will be moving on to our next speaker, who is, just grab my agenda, Dawn Gardner, who is the first vice president of the Ghanaian Public Service Union, who's going to be talking about kind of the specific context within the Caribbean, which is very different to what the situation is in the US, and kind of how they've been supporting their members to campaign and to win protections around violence and harassment. Dawn, please.
Thank you very much. Are you hearing me? Are you hearing me?
Yeah.
Thank you. Good morning, everyone. It's morning in Guyana, so I'm going to say good morning. For those who is in the afternoon, good afternoon to you. I am Dawn Gardner, and I'm the first vice president of the Guyana Public Service Union. For persons who are not fully aware, Guyana is the only English-speaking country in South America, with a population of less than 1 million people. The area of Guyana is 83,000 square miles. Guyana is known for land of many waters. Important to note that recently there was a high oil resource offshore. And Guyana, only yesterday, we start facing a challenge with oil. We have a gas issue currently affecting us in Guyana. On the other hand, the Guyana Public Service Union is the only trade union with a certificate of recognition from the Trade Union Recognition and Certification Board in Guyana to represent public servants. This also means that the Guyana Public Service Union is has the bargaining right, the only union with the bargaining right for all healthcare workers employed by the government of Guyana. Guyana Public Service Union faced a number of challenges over the years, including attacks by the government, which led to a decrease in its membership, resulting in a loss of income. Please take note that these healthcare workers are spread out across the length and breadth of Guyana, and Guyana has 10 administrative regions. The transformation of healthcare workers in the country is ongoing with the construction of new healthcare facilities throughout Guyana, the promotion of telemedicine, and the increase of technology in the delivery of healthcare. While all of this is done, there is still a limited staff resources or human resources at these healthcare facilities. Many times we have the nurse-patient ratio as 1 to 10. Sometimes we have it as 1 to 15. So understand the challenges that nurses face here in Guyana. It's not easy. Guyana is also facing a high migration of nurses. And these nurses are migrating to the USA, Canada, and the UK. And it's all because of improved work condition and remuneration. More recently, Guyana has also ended its agreement with the Cuban government. So resulting again in a decrease in the healthcare workers. Healthcare workers are the largest sector within the Guyana Public Service Union bargaining unit, but the membership is very low. And this is as a result of the migration, the large number of migration. However, the GPSU is working effectively to build power by promoting its membership involvement and also providing the necessary training for healthcare workers, getting them more involved, understanding their rights and their roles. Workplace safety and health is not where we want it to be here in Guyana. Even though Guyana has an Occupational Safety and Health Act and an Occupational Safety and Health Department, which falls under the Ministry of Labor. But the working condition very often is considered as very poor, where you have the working condition is not conducive very more often than ever. There is no lunchroom provided. Many times you go to the healthcare facilities and the nurses, the healthcare workers would tell you, I had to take my lunch, I had to take my meals in my vehicle because there is no lunchroom provided, which is in keeping with the Occupational Safety and Health Act. The washroom facilities are also poor at the healthcare facilities for the nurses. There is not adequate washroom facilities provided at these at these locations. Guyana has also ratified 9 of the 10 core labor standards convention. We have Convention 187, the promotional framework for OSH, and this is not ratified by Guyana. Guyana has not ratified that important convention. In terms of the harassment, Convention 190 has not been ratified. Despite numerous calls, requests from the Guyana Public Service Union and other trade unions in Guyana for the government of Guyana to ratify this important piece of convention and its recommendations. There's also very few workplaces that have a policy on the elimination of violence and harassment within the workplace. The GPSU is currently addressing this area and the high level of discrimination in the world of work, because discrimination is also very important here. And there is an increased number of cases on discrimination. And the discrimination also leads to racial discrimination within the workplace. Now, if I can also give you an example on the harassment, the Guyana Public Service Union, in support of the nurses, had to take legal action against a senior government official when he made some terrible remarks to the nurses. And there are cases where when these remarks are used and we have to take court action to resolve the issues. Here in Guyana, again, we took the union had a court matter in support of the nurses for the remarks, the harassment, discrimination and harassment against the nurses. The court award its judgment in favor of the nurses. And to date, that judgment has not been implemented. That court decision has not been implemented. However, the senior government official is off the job. But while he is off the job, the government still has a responsibility in ensuring that harassment, victimization, violence, discrimination, they eliminated in the workplaces. And we're not seeing enough coming from the government in terms of the elimination of these areas against the healthcare workers. In terms of the barriers the union face, the intimidation by senior government officials, the employment on contract in the permanent pensionable established positions, and the threats to the nurses by telling them that you are on contract. The employment on these positions of nurses are permanent pensionable established positions. And they're currently employing the nurses on contract, which means that security of tenure is very limited. The Guyana Public Service Union is working very hard in terms of having these positions, these vacancies filled on the permanent pensionable established positions. Now, the employer is using the contract for employment as a result of intimidation of the workers, driving fear in the workers. Again, we have a court ruling on this matter, where the court also rule in favor of the workers. We have workers are being employed on contract, and this is healthcare workers, and they have to wait 8, 7, 9 months before receiving a first employment. They are promoted and they have to wait months again in terms of getting the first increase in salary. At the Guyana Public Service Union, we have signed an agreement with the government of Guyana 2 years ago, and we're still awaiting the government to implement the full agreement. Where we have a clause in the agreement is the provision of a duty-free concession for our nurses. And to date, we're still awaiting that implementation. During the negotiation, it was agreed that the need for the healthcare workers, the nurses, to have a duty-free concession to own their own vehicles. Because, during the pandemic, the challenges the healthcare workers face traveling in public transportation. At the Guyana Public Service Union, we're not satisfied that the government understands the importance of the healthcare workers. We don't feel they understand the importance of ensuring that there's a safe and conducive work environment for our healthcare workers, which would result in the provision of quality healthcare for the patient. So it would also mean that the patient will benefit from the work environment, from the motivation of the staff, from the comfort of the staff when the healthcare workers are comfortable, is that the provision of quality healthcare will be guaranteed in the public service. And the focus should not only be on the development of the healthcare facilities. The government needs to understand more focus should be there on the human resources, which are the healthcare workers, not only the nurses, but the entire healthcare workers. We have a serious challenge here in Guyana but the Guyana Public Service Union is working very hard with its members to build power, to provide training, to have adequate educational sessions, involvement of our healthcare workers to ensure that the healthcare workers are respected, to ensure that violence and harassment is eliminated within the workplace, and also to ensure that the workers are properly compensated. To date in Guyana, the remuneration package for our healthcare workers is very, very low. The nurses, as well as other public servants, they are not earning a living wage, and that is one of the fight. A living wage is very important for our healthcare workers. I want to express my appreciation on behalf of the Guyana Public Service Union for us to be sharing our experiences, our challenges on this platform, and we're looking forward for working harder together, more in more unity with Public Services International and all other trade unions movement. I thank you.
Thank you so much, Dawn. Thank you. I think that's incredibly important, and particularly around the point you made around ratios and how there aren't enough nurses to kind of, or healthcare workers to treat patients, and kind of the impact that has on patients, and that leads to kind of more aggression, violence, and harassment. And also, all the work your union has been doing about winning the court cases, but even though you've got that win and that victory, the government is still not kind of understanding and implementing the judgment. And also your point around how it's not just around winning these judgments, but also making sure you're building workers' power, you're training these nurses, you're making sure that they're able to identify and spot and get those policies in their workplaces on how to prevent this. So thank you, Dawn. I'm hoping you can stay for the rest of the meeting. When we have our open discussion, there might be some questions directed to you. And I think it would be really great if, for you to also hear from some of our other unions as well. Okay, so our next speaker is we're going over to Sweden now in Europe. And our next speaker is from the Swedish Association of Health Professionals, Alicia Leikki, who is going to be talking about the work that you have been doing to support nurses. Alicia?
Thank you so much. Thank you for having me for speaking on this interesting topic and very important issue for all of us. My name is Alicia Lycke, and I'm a deputy unit manager representing the Swedish association, even called Vårdförbundet. Vårdförbundet is a growing professional union that safeguards the trade union interest of our members. We organize around 118 registered nurses, midwives, biomedical scientists, and radiographs. We work for higher wages, better and secure working conditions, professional development, and strong employment terms for our members. And for today, the topic that we put first is holding employers accountable. And firstly, I would like to begin by saying a few words about the legal framework, since it has such an importance for our work in our union. The legal framework surrounding violence and harassment in working life in Sweden are not regulated through collective agreement, but primarily through occupational health and safety legislation. The legislation consists of several components. First, we have a Work Environment Act. It regulates the employer's responsibility, the relationship between the employers and the employees, and the role of safety representatives. In our union, we have 5,000 elected safety representatives. This legislation's purpose is to prevent ill health and accidents and to promote good working safe conditions overall. Then we have the Work Environment Ordinance, which specifies how the law should be applied. We also have a regulation issued by the Swedish Work Environment Authority, which contain more detailed requirements for specific risks, such as threats and violence, high workload, and other workplace hazards. These instruments are very important for us as a trade union for our members. Finally, we have the Working Hours Act, which regulates daily rest, weekly rest breaks and pauses, factors that significantly affect the work environment and safety in this issue also. When it comes to occupational injuries and incidents, the employer bears the primary responsibility for ensuring that these are reported. Reports must be submitted both to the Social Insurance Authority and to the authority responsible for work environment and working hours. The employers also has the obligation to investigate the incident in order to prevent it from happening again, and this must be done in cooperation with the safety representative from our union. The safety representative, in addition to the right to participate in the investigation, also has the authority to demand measures when the work environment is deficient, and in case of immediate and serious dangers to workers' life or health, to stop the work, known as safety representative stoppage. Employees, in turn, have a duty to report incidents according to internal procedures, for example, through deviation reporting systems. These threats most often originate from patients, but significantly proportion also comes from relatives or next of kin. Common triggering factors, as you mentioned, is dissatisfaction with waiting times or care decisions, high workload and stressful care environments, a hard social climate, and reduced trust in public institutions and healthcare professionals. Physical violence is less common than verbal threats, but has increased over time. Typical forms of physical violence is hitting, pushing, being forcible, scratching, biting, headbutting, in certain settings, strangulation or chokeholds. There are particular settings in the care which is more high risk than others. And then I would like to point out the emergency and ambulance care, psychiatric care, elderly care, and addiction and social care. These environments often involve a combination of severe mental illness, alcohol, drug, high emotional distress. In recent years, particularly late 2020, additional risk factors have become more prominent, and that is threats linked to organized crimes, intimidation of healthcare staff perceived as collaborating with authorities. But what does Vårdförbundet do? Exposures to threats, violence, and harassments has increased within public administration in Sweden. This particularly evident in the healthcare sector, where it has become a serious work environment problem. Vårdförbundet therefore regularly mobilizes and conducts member surveys on the occurrence of the threats and violence, and the results are clear and alarming. The proportion of members experiencing a verbal threat at work has increased from 36% in 2018 to 43% in 2022. Regarding physical violence, 2018 was 18% reporting that they experienced and 22%. So It's rising, and the presence of weapons in the workplace has also increased. Vårdförbundet is very clear on this. It is completely unacceptable that healthcare professionals whose work is to help and support people and society in need of care are subjected to threats and violence and harassment in their workplace. Our union's work is to advocacy and support. We therefore work to strengthen legal and practical protections for our members, both nationally and locally. We do this in several ways. We map the problems through surveys. We highlight it through consultation and response and reports by raising the issue in public debate and by meeting with decision makers. We also emphasize the clear connection between poor healthcare and working conditions, employee health, and patient safety. We make clear demands on employers to work preventively, conduct risk assessments, maintain functional routines for handling violence and harassment, report all occupational injuries and incidents, ensure that managers and staff have the right training, for example, in safety protocols, and to collaborate with the safety organization. We mainly support the safety representatives and members, and that's the central part of our union's work. They are often ones on the front line where threats and violence and harassments must be handled in practice, and they must feel confident in the rules. We train them, and we also just small break here since I'm handling this. Are you still with me?
Yeah, we're all here.
I'm reading, so we train them, offer advice, and support them in local health and safety work. We also support members who have been personally affected. This involves listening, taking their experiences seriously, and engaging dialogue with employers. In our dialogue with the employer, we point out deficiency in the work environment and demand the right measures. And we make action plans and long-term preventative efforts so that no one else should have to go to work feeling afraid or at risk. Because of increasing gang crime and violence against our professional group, the Swedish Association of Health Professionals has worked to push for political action to support the work field further on. Political initiatives have been taken, but they have not yet shown the results we want, and we will continue our efforts. Through the cooperation with our social partners, we will start a 3-year research and prevention program. The program focusing on threats and violence at work for our professional groups. It is a joint effort that includes everyone working in this public sector. The results will then be shared and used by our joint organization Sunt Arbetsliv, which works with prevention and workplace safety. For Vårdförbundet, this is a fundamental issue of safety, dignity, and respect. Our members must be able to carry out their work without being subject to threats and violence and harassments. This is crucial for our members' health and for patient safety and for society overall. Thank you for letting me speaking on this subject.
Thank you so much, Alicia. Thank you so much for your comprehensive overview of the situation in Sweden. And I think your point around how the impact of workplace violence is not just physical, there's a big psychosocial risk, and the impact it can have on kind of burnout, and there's already a recruitment and retention crisis within nurses and wider healthcare workers. So how, everything's all linked together. It's, doing those trainings on the ground, but also kind of lobbying for better protection and legislation at a government level. So thank you so much for your contribution. Before we move on to our discussion part of the meeting, where we have a couple more speakers. I wanted to just highlight that I'm about to put in 2 links in the chat. So in the chat, if you could just introduce yourself, we have about 54 people on the call, so it'd be really great to kind of just have a sense of where everyone's from. So please just put your name and your union in the chat. And then I will put in 2 links. The first link will be to the what Danny was talking about, the violence and harassment workplace risk assessment. So that's something that you and your unions can look at. We have that available in multiple languages, in English, French, Spanish, and Arabic. And the second link I will put in is a set of materials we developed looking specifically around occupational health and safety. These materials were developed within focus groups, and as I mentioned at the start of this meeting, a lot of feedback from that was around how violence and harassment is a big issue for people providing care. The materials are developed looking at care workers, whether that's informal workers or formal workers. When we talk about formal care workers, nurses are a big part of that. So hopefully they'll be relevant to lots of people on this call. And so I'll put both of those in the chat. The materials are available in English, French, Spanish, Portuguese, and Arabic. So the next part of the meeting is going to be slightly more open for discussion. We have lots of different people on the call. It would be really great to kind of hear from as many people as possible. We've heard from unions in very different country contexts, but there have been some really key themes that have emerged. We've heard about how short staffing has an impact on the level of violence and harassment that nurses are facing. We've heard about how unions are kind of on the front line of pushing back against this. They're supporting their members on the ground. They're providing training. They're providing risk assessments. They're organizing their nurses to kind of win language within their contracts. We've also heard how they're campaigning and doing advocacy for new laws and legislation. So please, it would be really good to kind of hear from as many people as possible. But whilst everyone is formulating their thoughts and what contribution they would like to make, I'm very excited, as Danny mentioned, to now pass over to the Canadian Federation of Nurses Union, where we will be hearing from Angela Procanon, who is the Secretary Treasurer of CFNU, who's going to just quickly introduce the union as they're not affiliated to PSI, but they've been doing a huge amount of work around violence and harassment. They represent a significant number of nurses within Canada, and they're just going to be kind of quickly sharing their perspective. Angela, if you could just get on camera and then I can spotlight you.
Thank you, Huma.
There you are, found you.
All right.
Please go ahead.
And I have a slide
Yes,
presentation. I wonder if you
I
put that.
will share your slide
Thank you.
in 2 seconds. Where's the PowerPoint? Here you go. Hopefully everyone can see my screen. Great. Please, Angela, go ahead.
Okay, great. Thank you so much. There we go. So thank you so much for having me today, and greetings from Canada, everyone. My name is Angela Priocannon, and I serve as the Secretary Treasurer of the Canadian Federation of Nurses Unions, or CFNU. It's a privilege to be speaking to you today about this extremely important and topical issue for nurses. I'd like to briefly introduce CFNU, and we'll share some of the more recent advocacy we've been doing on addressing violence and harassment in healthcare in Canada. Next slide, please. Thank you. CFNU is the largest nurses organization in Canada, representing frontline unionized nurses and nursing students in every sector of healthcare, from home care and long-term care to community and acute care, and advocating on key priorities to strengthen public health care across the country. Our member organizations are provincial nursing unions from coast to coast. We are proud to have an associate members of the 40,000 student nurses of the Canadian Nursing Students Association. We also do work with La Fédération Interprofessionnelle de la Santé de Québec and enjoy a good working relationship with all unions that represent nurses and healthcare workers across the country. Patients and nurses need effective advocates. Nurses are the most trusted spokespersons in healthcare, and it is CFNU's role to ensure political decision makers in our nation's capital know what nurses think and where we stand on important health-related issues. We provide evidence to inform policymaking. Our mission is to serve as the national voice, advocating for nurses and high-quality public health care. Our vision is to be a strong national voice for unionized nurses in Canada and parts of world voice for unionized nurses, including the Global Nurses Union. Next slide, please. Today, to give you an idea of how pervasive violence is against nurses in Canada, here are some of the results from our latest National Nurses Survey released today. 95% of nurses in Canada have experienced at least one type of violence or harassment in the past year. Less than half reported experiencing violence or harassment over the same period. And 1 in 3 nurses fear repercussions for reporting work-related violence and harassment. Next slide, please. This campaign, called Code Black and Blue, the issue of violence in healthcare in Canada, while being at crisis level today, has been a very serious issue for nurses over many decades. The first campaign against violence in healthcare was led by the British Columbia Nurses Union in 1990. There have been numerous provincial and national campaigns since, including a Purple Ribbon campaign in New Brunswick in 2019, after a nurse was beaten senselessly by a patient's husband and was left badly injured, incapable of continuing in her career. More recently, the Ontario Nurses Association, of which I served for many years as the first vice president and many other roles, included the Code Black and Blue campaign, as you see here on this slide, to tackle growing incidents of violence against nurses in Canada's largest province. CFNU relentlessly advocates on the issue led the federal government's committee to study violence in healthcare in 2019, with a report containing a long list of recommendations for the federal government, which echo many of the CFNU's demands. We also worked with a member of parliament on the electronic parliamentary petition, which garnered over 8,700 signatures. One demand from the parliamentary study led to the federal government amending the criminal code back in 2022 to stiffen penalties against perpetrators of violence against healthcare workers, but unfortunately, the amendment has not been enforced. Next slide, please. In October of last year, CFNU held a policy breakfast briefing with the federal and provincial and territorial health ministers at their annual meeting. The focus of the briefing was on violence, given the severity and widespread nature of this crisis. We had an expert speaker and delivered a white paper on violence against nurses in Canada containing the following recommendations: strengthening enforcement in existing laws. Existing legislation and regulations are not being enforced. Investing in prevention and training. There needs to be individualized care planning and flagging of potentially violent patients and visitors, as well as comprehensive training on de-escalation, crisis intervention, and trauma-informed care. Mandate of safe staffing levels. We're beginning to see nurse-patient ratios implemented in some of the jurisdictions in Canada, but we need to see more of this model spread and scaled up across the country. Establish a national standard for violence prevention in healthcare. A national standard of Canada on the issue would be a pressure on employers and could be legally enforced if incorporated into provincial regulations. Ensure infrastructure upgrades are made to protect workers. AI weapons detection systems are being installed in hospitals across the country, and nurses and patients are reporting feeling safer as a result. There have been several incidents of stabbings and a disturbing amount of weapons being brought into our facilities. We need more of this technology along with security cameras and various ways of summoning assistance. Support workers affected by violence. Certainly workers need adequate psychological supports and leave options to recover from incidents of violence. Adopt recommendations from Parliamentary Health Committee reports. As mentioned earlier, there are many recommendations at the federal level from this report that have yet to be implemented nearly 7 years later, including a national public awareness campaign on the crisis. I want to thank you so much for this opportunity to speak about CFNU and the work that we do on this critical issue. And thank you so much, Huma and Daniel, for inviting us to be here today.
Thank you so much, Angela. That was great. Thank you. And I think it's really interesting to hear about the new technology that's kind of being implemented in workplaces, particularly around the AI weapons detection system. I think that's the first time I've heard of that. So, I definitely think there's some follow-up there because as unionists, when we hear AI, it's usually about eroding workers' rights and protections, but this is the first time I've heard it perhaps being used in a different way. So I think that's super interesting, and I think it's great to kind of for our unions and our affiliates to hear about kind of what other big nursing unions in different parts of the world are doing. So thank you so much for sharing that with us. And then hopefully Solange Catano from the Sao Paulo's Nursing Union is somewhere on this call. I did see you, Solange, and is
Olá,
also. Hola, hi Solange, hi. Solange is also going to be sharing her perspective as the president of the Brazilian Nurses Federation and also General Secretary of the Sao Paulo Nurses Union. Solange, over to you.
obrigada. Aqui pelo Brasil, bom dia a todos e todas. É um prazer estar falando com gente aí de todos os lugares, vendo as realidades, realidades impressionantes, né? Como você mesmo disse, é muito parecido de um local para o outro. Isso significa que, de fato, as diversas instituições, os diversos sindicatos, federações, enfim, entidades sindicais têm que trabalhar conjuntamente e tentar fazer uma campanha, quem sabe, aí, mundial pela questão da proteção dos profissionais de enfermagem em todos os focos da violência. No Brasil, a violência contra os profissionais de enfermagem, hoje, ela é reconhecida como um problema estrutural e crescente, né? Por mais que a gente tente combater, no último período, principalmente no pós-pandemia, essa questão da violência laboral, a violência no local de trabalho, ela cresceu muito e tem trazido impactos diretos na saúde dos trabalhadores, na qualidade da assistência, porque, óbvio, um trabalhador que não é bem cuidado, que sofre violência, seja ela física, seja ela mental ou qualquer outro tipo de violência dentro do seu local de trabalho, não tem qualidade de vida e, portanto, não tem condições de prestar uma assistência com mais qualidade. Isso afeta os sistemas de saúde, tem afetado as diversas unidades de saúde do Sistema Único aqui do Brasil e é óbvio que o funcionamento do sistema ele acaba não sendo perfeito como a gente gostaria que ele fosse, exatamente porque nós que somos profissionais de enfermagem, que somos enfermeiros, somos a base de sustentação de qualquer sistema de saúde e que, portanto, precisamos estar com uma saúde perfeita, né? Sermos valorizados, sermos reconhecidos e, principalmente, sermos protegidos pelos diversos governos. Eu queria trazer aqui alguns dados, né, mais recentes que trouxeram aí, no último período, uma preocupação bastante grande para a Federação Nacional dos Enfermeiros. E antes de falar disso, quero falar, a Federação Nacional dos Enfermeiros representa hoje 720 mil enfermeiros. Ela traz como guarda-chuva de organização 19 sindicatos estaduais de enfermeiros, inclusive alguns aqui presentes com a gente, né? O Sindicato da Bahia, São Paulo, Pernambuco, estão aqui junto nesse debate. Se depois cada um quiser também nos comentários falar um pouco das suas realidades, seria bom. Mas hoje nós temos cerca de 70% dos profissionais de enfermagem relatam que já sofreram algum tipo de violência no local de trabalho. E mais de 60% relatam violência no último ano, incluindo agressão verbal, física e assédio moral, né? Nós temos que de cada 10 enfermeiros que sofreram violência, pelo menos 7 acabam não falando, não denunciando, por falta, por medo ou porque não tem apoio institucional ou não tem apoio da equipe e aí acaba não denunciando. Isso significa dizer que esse índice de 70% de profissionais que já sofreram algum tipo de violência, ele pode ser maior, porque é uma subnotificação dos casos em que os trabalhadores eles acabam não relatando por medo ou por falta de apoio. A gente também mapeou os principais agressores, né? Quem agride esses trabalhadores? Quem são os principais agressores? Então, no caso aqui dos profissionais de enfermagem do Brasil, nós temos que, em primeiro lugar, os principais agressores ou são pacientes ou são os familiares dos pacientes. Essa é a grande maioria. Então, no nosso ponto de vista, é preciso trabalhar um sistema eh, de informação e de é, proteção para junto com a comunidade, para que eles entendam de fato qual é a importância dos profissionais de enfermagem na assistência, na vida deles, para que eles, em vez de agredir os profissionais, eles acolham esses trabalhadores, eles protejam esses trabalhadores, e não que seja na contramão da história. É, o segundo lugar é outros profissionais de saúde, né? Aí os outros profissionais de saúde entram na regra do assédio moral, não é violência física nem violência verbal, mas é o assédio moral, muitas vezes pelas relações hierárquicas, ou muitas vezes dentro da própria equipe, médicos que agridem ou que assediam enfermeiros, né? E dentro dessa violência com membros da equipe, nós temos que dizer que também existe o assédio sexual, que muitas vezes acaba acontecendo com os nossos trabalhadores entre membros da equipe, e que também tem que ser monitorado. Lembrando aqui que nós somos uma categoria majoritariamente feminina, e os problemas que estão elencados com as mulheres são os mesmos problemas que as enfermeiras enfrentam todo dia. Por isso que eu digo sempre que a luta das mulheres é a luta das enfermeiras, e a luta das enfermeiras é a luta das mulheres, nós estamos juntas, é praticamente a mesma coisa, né? E em menor escala, a violência institucional, mas que tem crescido muito no último período, né? A violência por sobrecarga de trabalho, por pressão constante no local de trabalho, por falta de planejamento, por falta de autonomia profissional. Então, todos esses quesitos acabam se transformando em violência contra o trabalhador. E, essa questão da falta de autonomia, da sobrecarga e da pressão, ela tem sido tão presente nas instituições de saúde aqui no Brasil, que no último período nós, inclusive, tivemos um aumento do número de suicídios de profissionais de enfermagem, muitos dentro dos seus locais de trabalho, por conta dessa sobrecarga, por conta dessa pressão. E um segundo problema que vem aparecendo, eu não sei se acontece nos outros países ou não, também é o aumento da utilização de drogas, que eram drogas lícitas dentro das instituições de saúde, né? Nós tivemos, há uma semana atrás, o suicídio de um profissional, um enfermeiro, dentro da sua instituição, por uso de fentanil, né? Na realidade, a gente não sabe se foi suicídio ou se ele estava utilizando e acabou errando a dose e acabou indo a óbito. Ainda está em análise e investigação. Mas tudo isso são consequências das sobrecargas que nós estamos sofrendo nos nossos locais de trabalho constantemente. Então, assim, para os nossos profissionais aqui no Brasil, o que tem trazido como consequência, né? A ansiedade, aumento das crises de ansiedade, afastamento por conta da questão do estresse, da síndrome de burnout, o número de afastamentos, eles têm triplicado, e aí é óbvio que sobrecarrega mais o sistema, sobrecarrega quem fica no plantão, porque não tem todos os trabalhadores que deveriam estar na equipe, porque não há uma previsão de substituição desses trabalhadores. Então, muitas vezes a escala fica praticamente zerada, e aquele que fica acaba mais sobrecarregado ainda, né? E óbvio que isso leva a uma desmotivação e uma evasão da profissão que tem acontecido no último período, né? Então, nós temos que trabalhar também essas questões. Para nós, uma das conclusões é que isso não é um problema só da enfermagem, ele é um problema de saúde pública, porque afeta o sistema de saúde como um todo, porque a enfermagem é a base de sustentação do sistema, então não tem como não dizer que não afeta o sistema de saúde como um todo. Nós temos trabalhado algumas medidas, né, aqui no Brasil. Primeiro, campanhas de combate à violência laboral e assédio moral, que a gente tem trabalhado com o governo brasileiro, e aqui eu quero dizer que só é possível porque nós temos um governo popular e democrático que escuta os trabalhadores e que tem dado abertura para a gente participar das mesas governamentais que discutem isso. Então, o Ministério da Saúde hoje tem uma mesa nacional de negociação permanente do SUS, que funciona com membros do governo brasileiro, membros das entidades sindicais de diversos setores, mas principalmente membros da saúde, né? E gestores como o Conselho de Secretários Estaduais de Saúde, secretários municipais de saúde, que tem feito nessa mesa o debate de como melhorar as condições de vida e condições de trabalho. Então, via mesa, a gente tem lançado campanhas e mobilizações sobre o combate do assédio moral e a violência laboral. E mais próximo, de forma mais abrangente, um combate sobre a violência laboral, aliás, sobre a violência de gênero, porque como nós somos maioria mulheres, não tem como não fazer e não trabalhar a questão do gênero junto com com os demais trabalhadores. Acabamos de aprovar o plano de cargos, carreiras e salários de todos os profissionais de saúde do SUS, né, na mesa nacional. Agora foi para o Conselho Nacional de Saúde, que é o nosso órgão que dá o aval das questões que são debatidas no Ministério da Saúde. Já foi assinado o protocolo e agora a gente vai começar a trabalhar a advocacia com o Congresso Nacional para transformar o plano de cargos e carreiras em um projeto de lei e uma lei que vai beneficiar não só os trabalhadores da enfermagem, mas todos os trabalhadores do Sistema Único de Saúde. A gente tem feito audiências públicas e debates sobre a questão da violência laboral no trabalho. Também temos trabalhado a campanha da ISP pela ratificação da Convenção 190 aqui no Brasil, porque o Brasil não ratificou ainda a Convenção 190 e nós entendemos que ela é fundamental e essencial para que a gente possa melhorar condições de vida e condições de trabalho dos profissionais de enfermagem também. E fora isso, só para concluir, porque já estou falando aqui bastante, além da ratificação pela Convenção 190, nós também temos trabalhado a questão da migração, porque nós entendemos que ela acaba piorando com a evasão acaba piorando o dimensionamento de pessoal de enfermagem e, consequentemente, a sobrecarga e, consequentemente, a violência laboral. E a migração tem afetado muito os profissionais aqui no Brasil, porque tem muitas empresas que vêm recrutar mão de obra aqui para outros países. Nós temos trabalhado a questão das mudanças climáticas, porque nós entendemos que é também um dos focos que ajuda a piorar e sobrecarregar. Nós tivemos os casos do Rio Grande do Sul, dos desastres, em que nós tivemos profissionais sendo afastados por estresse, por ansiedade, porque não estavam capacitados e não tinha gente suficiente para estar junto lá nos desastres do Rio Grande do Sul. E isso é só um exemplo, tiveram outros pelo Brasil que também aconteceram a mesma coisa. Enfim, a gente entende que trabalhar a questão da violência laboral é muito mais abrangente do que só o foco da violência em si, que a gente tem que trabalhar as outras questões que também são importantes, que influenciam diretamente no dimensionamento, na sobrecarga e na violência laboral dos profissionais. Era um pouquinho disso, eu fico à disposição se alguém quiser fazer alguma pergunta depois, tá bom? Obrigada.
Thank you so much, Solange. Thank you so much. That was great to hear about all the work that you're doing with your union. And it's great to see so many members from the union here on this call. I've seen in the chat how many people have been introducing themselves. And I think it's really great to see all the participation and how this is such an important issue for your members, but also linking it into how, as Danny was saying, and you have been saying, that not all workers experience violence in the same way, that different types of workers, including migrant workers and migrant nurses, will experience different levels of violence and harassment. So thank you so much for your contribution. So we have around 15 minutes left, which I know isn't a huge amount of time, but I really wanted to open the discussion up in case anyone wanted to kind of share their kind of thoughts or contributions. We also, hopefully, will be hearing from a new-ish member of staff at PSI. I'm sure some of you have seen her. She's been in a lot of different meetings that we've had. But Lina Jamul, who is the head of union building, which is where their health team sits under, with the other sector teams. And she kind of heads up all our work around sector and union. I really wanted to give her about 5 minutes to kind of link the work that we're doing in nursing and within the nursing sector with the wider organizing work we're doing within the health sector. I think I probably will go to Lena now. So then if anyone has any questions, they can just put their hands up, or if they want to make a contribution, we'll go to that straight after Lena. So if you would like to contribute, please do put your hand up via the reactions at the bottom of the screen. But Lena, I'll hand over to you now because I think we are a bit tight for time.
Thanks, Huma. Yes, it's nice to see everyone, and it's incredible to hear your stories on violence and harassment for nurses. As Huma said, my name is Lina Jamul. I've been at PSI for 6 months now as the head of union building. I come to PSI from the Solidarity Center, where I was the country director for North Africa, based in Morocco. And I was the executive director and organizing director for a public sector union in Minnesota, 15,000 state workers. And originally, I'm from Syria. I was born in Damascus, and my parents tried to organize a non-aligned political workers' party in opposition to the military dictatorship, and that's why our family left. So I say this to you because to say that I feel most at home with other internationalists. And so it's incredibly exciting to hear stories from the US and Canada and Brazil. So nurses, so Huma asked me to talk about organizing the process of building power, which is really all our organizations, but particularly nurses are steeped in organizing, of nurses coming together to realize and build collective power, to improve working conditions, pay, respect and dignity at work, and healthcare for patients. Organizing is who we are, it's how we were formed, and it's also how we advance. It's how we have impact on the issues that matter to workers, whether that's violence and harassment and safe staffing levels, overwork, overscheduling, and more structural issues that sit behind those, of workforce shortages and public funding shortages. Power is our ability to organize people, is our ability to have an impact on those issues. And I'll just try and share a very brief organizing story from Minnesota, from my time in Minnesota with you, in a bargaining unit of 15,000 workers, where membership sat at about 60%. But if you looked at union membership for younger and newer staff, it hovered around 30%. So this meant that as retirements happened, and newer people entered the workforce, there was you could see a slow and steady decline if we kept business as usual of the union. And at the same time, in the US at the time, there was a court case making its way, attacking public sector unions and ability of unions to collect dues and funding, from the right wing, the Janus Supreme Court decision. So this union, we had done a good job representing workers if they got into trouble at work, and a decent job in negotiating and good collective bargaining agreements. But it was hollowing out over time. It was built around a smaller group of workplace leaders and staff who were doing who were working on behalf of other workers. So people would come, younger, newer workers would come to meetings and would say things like, I understand what you're doing is important, but I don't understand why you need me to be involved. And so we really needed to shift that. And in order to grow our power, we had to grow a high participation union. And that meant having organizing training, expanding on who was a leader, expanding the notion of leadership, and opening up opportunities for more workplace leaders, that they didn't necessarily need to have an official title to exercise leadership and agency inside the union, and then deep listening to workers across wherever they were, face to face. And so we heard feedback like someone who was about to retire said, wow, this is the first time I'd seen someone from the union come and talk to me. And then opportunities to take collective action on issues that were important to members. And so if we fast forward doing this work for 3 years, we increased by hundreds of people, those who saw themselves as workplace leaders and were active and had ownership over the union, talked face to face with over 10,000 state workers. Membership was increased by 15%, which was a net growth of over 3,000 members. And because we were organizing around issues that collectively that workers cared about, we won paid parental leave, 6 weeks of paid parental leave for mothers and fathers for 40,000 state workers in Minnesota. That then led on to become built on to be paid family leave for all those who live in Minnesota. So I say all that to say it's important to celebrate our organizing traditions and to say we want to hear your organizing stories. So please feel free to share them with us and type them in the chat. And we want to be showcasing them in PSI's newsletter and also learning from each other. And at PSI, as Danny mentioned earlier, we're supporting affiliates to grow organizing capacity across the health sector, as well as leveraging those affiliates who have strong organizing capacity to support all of us. So the Norwegian Nurses Organization, for example, which says some of the highest union density of nurses in the world, over 70%, is supporting work in Africa. Myself and Abby will be traveling to Zimbabwe later this month to support the Zimbabwe Nurses Organization in their organizing work. And I know our colleague Ananya, who leads on the healthcare organizing in Asia Pacific, is also on the call. And so that is tried to wrap it up very quickly because we do want to hear from you. But also just a very quick plug because the International Migration Review Forum is happening and Ananya will be working on, we know that nurses are hugely impacted by migration. But if there are affiliates who want to work with us on this, it's coming up early May. Please type in the chat and we'll follow up with you later.
Great. Thank you so much, Lena. And I think it's kind of hugely important when we talk about these core union issues about linking it back to kind of organizing and the specific work that PSI is doing, because I know it's something we've been focused on in lots of different parts of PSI, but now that we have Lena in post, it's going to be something that we only expand our work on. We have literally 5 minutes, which probably isn't enough time to open it up to discussion, which I'm really sorry about, but I just think there's been so many great contributions from so many different parts of the world. And as I was saying earlier, that even though we have been hearing from people from different countries, there have been some really key kind of overlaps when we're talking around violence and harassment and the issues facing nursing. I don't see any hands up, so I'm guessing there isn't anyone who has a burning desire to contribute right now. But please know, and the fact that I've seen so many familiar faces, this is not the only opportunity to contribute and feedback to PSI. We have lots of stuff going on at regional level around health and care, which is where nurses sits. We have stuff at global level. We have different kind of portfolios. What Lena was saying about the migration work around kind of safe staffing. So, and obviously you have my contact details via the registration. So you can email me at any point if you would like to feedback in writing around the work that your union's doing. But I really want to thank all the participants today. Thank you everyone for kind of coming out and sitting with us for the last hour and a half and hearing from the different speakers. A big thank you to all our speakers. I think your perspectives were incredibly interesting and really valuable for us to hear about kind of the work you're doing on behalf of your members, but also how you're bringing your members along with you, that it's not some sort of top-down union process. You're hearing from what's going on from your members and their workplaces, and you're kind of taking action in partnership with them. So thank you so much for all of our speakers. Thank you to the interpreters for your support. Thank you to Florence, who has been our head office tech support here. And then thank you also to Danny and Lena for supporting the agenda today. Great. Thanks, everyone. See you guys soon. Hopefully this is, goodbye for now. But I'm sure we will be in touch. And again, you have my email, so please get in contact at any point. Peace out. Bye.
Thank you, Huma, for putting this together. Thank you, everyone, for attending.